Okay.
Good to
Oh,
get started?
that was
Okay.
a good time. And a reminder to the audience, please mute yourself when you join. Thanks. Okay, Agnes, that was good.
Thank you. Good afternoon and welcome to today's Research America Alliance discussion. I'm Agnes Varghese, and we're so grateful that you're all able to join us for this conversation about a very important topic, which is making progress against chronic pain. And I think I'm just going to start with a quick couple of housekeeping notes. So, if your organization is new to our organization and you find yourself a little Research America curious, we'd love to connect with you. And you can reach out to Donald Cook, our Associate Director of Membership and Development Operations, to learn a little bit more about our alliance. His email should be popping up in the chat soon. And also, just in terms of structure throughout today's discussion, feel free to drop your questions into the chat as well, and we'll get to as many as we can during that audience Q&A portion. So thank you for bearing with me on that. So just to ground us in the issue for a moment, I remember reading somewhere that pain is your body's way of telling you that something is wrong. It's almost like an alarm. And when that alarm continues to go off for months or with chronic pain, even for years, I guess it starts to impact several different aspects of your life and essentially really take away your joy as well. And so for people who are living with chronic pain, it makes them put in a situation where it's harder for them to be active, to engage with their family and friends, and to just carry out those basic day-to-day activities that they used to be involved in. And we found that chronic pain is actually also one of the leading reasons that people end up being out of work in the United States. And over time, that chronic pain can lead to a lot of other health challenges as well, which then can make it even more difficult to manage. So this is no small issue. And in the promotion that we've done for this event today, we mentioned how nearly 25% of adults in the US are living with chronic pain. And it also carries such a major economic impact that costs hundreds of billions of dollars. I think last time I checked, it was something like $600 billion. So it's probably more than that now per year in healthcare costs, lost productivity, and whatever other consequences are involved as well. And despite how many people it impacts, there's a lot of work that we have to do to better understand, especially when it comes to how chronic pain is experienced across populations and what approaches are most effective over time. And that's what brings us to this conversation today. There's actually legislation that's being developed. It's called the Advancing Research for Chronic Pain Act. And that's actually focused on improving how we understand chronic pain and how we strengthen that evidence base for treatment and care. So we're really glad to be joined today by Siobhan Murray, who works on health policy in the office of Senator Tim Kaine, who represents the state of Virginia. She's going to discuss the legislation that we mentioned that the senator is leading to overcome these gaps and accelerate the development of safe and effective solutions for chronic pain management. Siobhan, thank you so much for being here and for all the work that you're doing on the issue.
Thank you so much for having me. I'm very excited for this discussion today. Good afternoon, everyone. I'll start with a little introduction. My name is Siobhan Murray. I'm Senator Kaine's legislative correspondent that supports his work on the Health, Education, Labor, and Pensions Committee, or HELP Committee. I have been in this role for around a year and a half, but I have been with Senator Kaine's team for about 3 years. I have previously worked as a district staffer in his Fredericksburg and Roanoke offices. And in my experience as a district staffer, I truly recognized and saw the importance of a constituent's voice and how it truly drives policy. And this bill is a great example of that. And as Senator Kaine travels across the Commonwealth as well, he very often hears about the invisible and exhausting weight of living with chronic pain. And so that leads us to the bill we're talking about today, Advancing Research for Chronic Pain Act. This is a bill that began with Senator Bob Casey of Pennsylvania. And when he left the chamber last Congress, although we were very sad to see him go, our office was eager to pick up this bill and to continue to push for its passage. We knew the groundwork that he laid was essential, and we were committed to continuing our support for it and prioritizing the patient experience on a national level when it comes to chronic pain. And so to discuss some of the issues that Senator Kaine is really passionate about that reflects in this bill, I'm going to start with data modernization and the data gaps. Throughout the senator's career, he served as a city councilman, mayor, governor, and senator. And he always talks about how he recognized this issue of gaps in data sharing. There were silos between levels of government, whether it be local, state, and federal agencies, as well as once he arrived to the federal government, between agencies. And so throughout his career, he saw how different levels of government failed to solve problems because the left hand didn't know what the right hand was doing. There have been entire populations omitted from vital research due to geographic, racial, or gender divides. And as we get to the federal level, the scale of these gaps just increases. We have brilliant scientists and physicians at the NIH, the CDC, and the VA, but very often the work that they're doing is confined to their singular agency, sub-agency, or sometimes just to their own lab or office space. And so modernizing data sharing as well as identifying data gaps help us see trends in real time. It allows us to identify which therapies are working for which demographics, and generally just moves us away from this idea of one size fits all towards a model of whole person medicine. And so leading into the second issue, I would say, is the aging population. Across the country and in Virginia specifically, our population is aging, and that population experiences disproportionately high rates of chronic pain. And as we see those numbers rise, this issue of identifying gaps is something that cannot wait. It's important that we proactively modernize our data systems across agencies and levels of government so that the next generation of therapy is comprehensive and data-driven, as opposed to the one-size-fits-all, like I mentioned earlier. And so sharing information is sharing, the burden of finding a cure and recognizing which populations are disproportionately impacted. And so we need to address these gaps now as we continue to watch our population grow and age until it's a public health crisis that if we're not equipped to track, we cannot treat. And so another population that the Senator Kaine cares deeply about that drives a lot of his policy is the high military and veteran population that we have here in Virginia. And so we're home to one of the largest veteran populations in the country. And this is another group that experiences chronic pain at a significantly higher rate than the general population. And that is a result of the sacrifice and the service that they made to our nation. And so for Senator Kaine, this is about more than just addressing, a specific goal and meeting a certain mark. It's about fulfilling, the duty of the federal government to pay back the service of these veterans. And that treatment trickles down to the general population, as we've seen in other spaces. And I think we all know that chronic pain does not care who you voted for, which is why this bill is a bipartisan priority. We're committed to working across the aisle because it is clear the state of things is unacceptable. As Agnes mentioned, the most recent study when it comes to the economic impact is close to $600 billion. And so if we're talking about fiscal responsibility, that seems like a clear area that we need to address and address now. We continue to hear that more research is needed, but we may be missing the moment in providing the tools and resources so experts can actually do that research efficiently. We need to make sure that definitions are standard and that data is shared so that the same study isn't happening in different departments using different standards. And especially at this time, it's important that every dollar we put into medical research comes back to us and with tenfold in an ideal world. And so The Advancing Research for Chronic Pain Act is designed to address many of those issues and more. It's about creating a centralized hub and standard definitions so that a breakthrough in a VA lab in Hampton Roads can help inform a treatment plan in a rural clinic in Blacksburg, Virginia. And so, as I mentioned earlier, this bill originated with Senator Casey, with us as a co-lead. Last Congress, it passed through the Help Committee with bipartisan support as a provision in the Support Act. And although it did not make final passage, which was signed into law this past December, we are incredibly encouraged by its past bipartisan support and believe we can continue to build on that progress. So now to just walk through the section by section briefly, it's a short bill, a little bill with big goals.
And
So
sorry,
the
1 second, Jacqueline, I think can post the section by section
Great.
in the bill. Sorry, in the chat in case people want to follow along. Go ahead.
Very helpful. So the first section is, directing HHS, CDC, and NIH to utilize the data that's currently available to them to clarify the incidence and prevalence of chronic pain. I think, in general, we recognize that about a quarter of our country are experiencing chronic pain. But I think anyone who is really present in their communities knows that that probably is an underestimation, even with it being such a high number. And so another part of the bill is identifying gaps in research. So certain factors such as demographics, risk factors, effectiveness of treatment, opioid alternatives. And so that's sort of recognizing what demographics are disproportionately impacted, what treatments work for specific demographics, and working on this whole person approach and away from the one size fits all. Developing recommendations for definitions and appropriate approaches for population research. The data comparability is really vital, a vital piece of this bill. And that's what will allow, a research lab in California and a research lab in Virginia to be using the same standards, even if they aren't directly communicating with one another. The second part of the bill, which is sort of the crown jewel, is this chronic pain information hub. And so the idea there is that the CDC would, establish a web page where they post all of this information, all of this research that's gathered, disseminating current and future data collection, translating findings into recommendations and clinical resources. So that looks like a physician visiting the website to provide a treatment plan, or a patient visiting the website to advocate for themselves using this centralized data that's now available to them. And I think the last real important piece that may seem simple, but is so vital, is a standard definition. So we have that as persistent or recurrent pain lasting longer than 3 months. And that is, similar to a lot of the current recommendations, but it's just really vital that different agencies, whether it be public or private, have the same definition. So we know the data that's coming out of it is reflective of these standard definitions. And so to all the patient advocates and endorsing organizations listening, just wanting to urge you all to continue sharing your story. The data is incredibly important, and that's what this bill does, but it is patient advocates and constituent stories that really drives legislation forward. And although this bill is focused on data gaps and tracking, the ultimate goal is to lead to more comprehensive, individualized treatments. Senator Kaine in our office is committed to this bill, and we appreciate the expertise that you are all able to provide as we continue to grow these data systems and just hope to reflect the needs of the patients. So just want to thank you all for having me again today. Would be happy to connect with any organizations afterwards if you're interested in providing your endorsement of the bill, or talk more with patient advocates of what you can all do. So thank you again, and I'm excited for a discussion and some good questions.
Thank you, Siobhan, for that great overview. I think I really love that line that chronic pain does not care what member you voted for. With this, I just wanted to ask, digging into the stories a little bit more, what were some of the stories that you've been hearing in the stakeholders and advocates that you've been in conversation with? And also, folks who submitted questions prior to this event had seeked interest in what the senator's personal investment is in this legislation. Is there a story that he has as well?
So, although Senator Kaine doesn't personally deal with chronic pain, he continues to hear stories across the Commonwealth. And I think his position on the HELP committee really reflects the issue of chronic pain. Because although chronic pain, may just seem as a physical manifestation of a health issue, it greatly impacts our workforce more than we can anticipate. And so that is a real pivotal point when it comes to these veterans conversations, because veterans have dedicated their life to service, and even after they finish their military service, continue to dedicate their lives. They make up a large portion of the federal workforce. And so I think a lot of times the conversations of people dealing with chronic pain are that they want to continue working and they want to, contribute to service and to larger things. And they just are not able to because the resources aren't available. I think another Virginia specific thing is how geographically diverse our state is. And so constituents who are in Southwest Virginia, they're, struggle to find physicians, let alone a physician who can take the time and recognize their chronic pain, because chronic pain is often self-reported. It doesn't have these typical biomarkers like diabetes would with a blood test. And so I think it's sort of this comprehensive issue that Senator Kaine's role as a HELP committee, as well as representing Virginia, really just touches upon. It's this workforce issue, it's an access issue. And people want to work, they want to contribute. And this pain has its own psychological comorbidities as well when we talk about the rates of depression and anxiety being so much higher than the general population. So yeah, thank you for that question. I think you may be muted, Agnes.
Sorry about that. So I think a question in the chat is somewhat alluding to this as well, but that talk of the non-opioid and opioid-sparing treatment approaches for chronic pain. The bill mentions assessing the utilization and effectiveness of those. How could this research really reduce reliance on opioids while increasing and improving patient outcomes?
Yeah, absolutely. And that provision specifically is something that we have been working on in this new Congress. It wasn't included in previous iterations, but we think it's really essential right now. And if that weren't included, we'd be missing the mark really broadly. I think for a while, a lot of the research and legislation in this area was about combating the opioid crisis, which was absolutely necessary at the time. But now it's about shifting the focus to the chronic pain crisis, which will in turn limit that opioid usage. And so that's another thing I think Senator Kaine hears a lot about across Virginia with people who are dealing with chronic pain, is sort of this stigma around, going to seek treatment and, the opioid usage, the stigma around that. And so if people had the research to show that non-opioid alternatives also work, that would help integrate it more easily into the standard of care. And that goes into, this centralized data hub helping patients advocate for themselves. So when they go to seek pain, they aren't dealt with stigma around opioid use. They can point to specific studies that show, no, there are alternatives, and this is what I'm coming to ask for. I want my pain to be addressed, and there are more ways to do so. So I think right now it's really important that we're focusing on these non-opioid alternatives. Obviously, the opioid crisis is something we continue to combat and focus on. But if we're going to do that, we need to holistically address the stark numbers of chronic pain that people are dealing with.
Yes. And in addition to that, other alternatives that were mentioned from some folks submitting questions had to do with things like plant botanicals for chronic pain as opposed to pharmaceuticals, and also looking at that biopsychosocial nature of pain, and the adoption of psychological pain management and other non-pharmacological interventions. Could you address any of that as well?
Yeah, absolutely. So the technicalities of those treatments are certainly beyond my expertise, but that sort of leads into the crux of this goal, which is enabling the experts to have the resources and tools that they need. It's important that they are able to analyze a comprehensive spread of treatments for pain because it's different for everyone. For some people, that opioid is the only path towards relief, and they need to have the resources and support from their physician and researchers to get them without any stigma. And for other people, it's these, non-opioid alternatives or botanical alternatives. But the only way that patients are able to advocate and receive that treatment is if the data is there. So although I can't speak, technically and scientifically on where we're at with those treatments, I think it's really important that this bill enables, patients, researchers, and physicians the data to make these personalized decisions.
Thank you. And I see a question about how patients can be involved in the process. And I know you spoke generally initially about how people can advocate. Can you touch a little bit more about how interested advocates and organizations listening today, how they can engage with and support the effort, and what perspectives are most helpful right now as this bipartisan piece of legislation moves forward?
Yeah, absolutely. So, as we've discussed, the crux of this bill is about data. And statistics and data is the foundation towards any federal policy. But it's the patient story that really drives legislation. It's humanizing the issue beyond the numbers. Yes, 600 billion is a huge number when talking about the economic impact on our country. But a lot of times, a single story, looking someone in the eyes and explaining your personal experience moves them more than that number. So I think, as we focus on data, we rely on you guys to humanize the issue. And to just talk about the current state of the bill, we're still looking for a Republican lead. And so for any of you guys who have Republican members representing you, taking meetings with their office and encouraging them to lead and support this bill, and a lot of times that comes through your stories. And so and across all healthcare sectors, anytime I have a meeting with patient advocates, I try to finish with really assuring them how important and vital their advocacy is. Sometimes it may seem that you're just sharing a story and in a 30-minute meeting and you move on, but that is what drives policy. And so we really encourage you all to take meetings with your member offices, especially at the other side of the aisle of us, and share your story to humanize this issue and make members sort of recognize that their constituents also, demand progress here. We're missing the moment, and it's time to address this. And so your stories really help us do that.
In terms of the data that and the gaps, what were some of the most surprising gaps that you've seen? What doesn't exist that really boggled your mind that this should exist?
Hmm. I think specifically it's not so much what doesn't exist, but it's my belief that so much of these numbers are underestimations. And the
Mm.
numbers are huge as they are. It's a quarter of the American population. It's the 600 billion economic impact. But these numbers, it is underreported. And I think a lot of times we rely on patients to self-report. So it's important that we are proactively providing this comprehensive data gathering and addressing these gaps so that it's not on patients who are in, vulnerable populations or geographic areas that are removed from these institutions, that we are proactively going out and getting that information.
And curious to know who some of the biggest stakeholders have been that you've been in conversation with about this legislation.
Yeah, so in the original drafting of the bill, we are incredibly thankful for the work that Senator Casey's office did. He worked with a lot of different organizations, and I think primarily the U.S. Pain Foundation in sort of drafting this bill. I would say it was the patient advocates that drove the creation of the legislation, and then it was the endorsing organizations that helped us refine the text. And so hopefully in our next step, we continue to work with the administration and the agencies in, uplifting them and giving them the capabilities to, do what we hope from this bill.
Okay. And I see a question in the chat is, would your office be interested in speaking with chronic pain patients who also conduct pain research at an R1 institution in a rural area with limited access to treatments?
Absolutely. I think, representing Virginia, the rural population is something that's so important to Senator Kaine. And especially given the current time, a lot of the changes that are happening in the healthcare industry are disproportionately impacting the rural populations, which are already underserved. And so I would be more than happy to meet with researchers to hear about your opinions on this bill. What can we do better to address, these rural populations? What do you see coming in the next couple of years? And what the next bill might be that could hopefully build on this if we get passage. So
Yes.
yes, I encourage you all to follow up with me. I would love to meet and discuss more.
Yes, and feel free to reach out to Siobhan at Tim Kaine's office. And I see a question from Heidi about putting the bill number in the chat. So the thing is, it has not yet been introduced. So once it is introduced, to keep an eye out. I think, Siobhan, you might have mentioned that there's a distribution list. If they contact your office, would they be able to get information about when the bill would be introduced?
I'm not, I believe we have a distribution list, but I'm not sure if it's specifically on this bill, but I can connect with some other staff and follow up on that specifically. But, would love for people to reach out and can add you to our endorsing organization tracker, which will have, notifications there.
Thank you. And just speaking of next steps in general for the bill, after it is introduced, what are the elements for the path forward for it, and how do you feel given what you've learned as the administration's priorities, both generally and for agencies like CDC during this appropriation cycle, and anything else that people should be watching out for in the next couple of months?
Yeah, so we're encouraged that last Congress, this bill passed through the Help Committee. It had a bipartisan markup as a provision in the Support Act. And so although it wasn't included in that final passage, it had that first step of getting past the Help Committee with bipartisan support. So already we feel if it were to be called for a markup, we'd have that leg up where it was like, we've done this before, let's do it again, but this time let's push to get it across the finish line. And I think, chronic illness as a whole has been a bipartisan priority and a priority of this administration. And so it's our hopes that we can build on that and work with partners across the aisle to, challenge them to meet the moment that if that's their priority, here's a vehicle that we are ready to move towards and move forward to address these issues. And so it's always the hope that there will be a big health package at the end of the year. And if there are, we will continue to push for this. But nothing is certain. And so we're just going to continue to try to build on the progress from last Congress to convey that this is a bipartisan issue then, and it has only grown in support since. And that's where you guys can all help us in any meetings you have, or even just a phone call to an office to support this bill.
Thank you. And every Congress is 2 years, right? And
Correct.
there's so many bills that are introduced during that time, but definitely not as much that make it across the finish line. And, given what all the external priorities are. And so the fact that it made it this far last time, it means something. And
Absolutely.
so, steps forward could include going even farther this next time once it's
Mhm.
introduced. So there was a question for clarification, and I know this is relevant to CDC, but if you just want to clarify one more time about, do you envision this effort would be housed in and led by HHS with collaboration outside of HHS? What might be the incentive to encourage agencies to collaborate?
Yeah, that is certainly the ultimate goal. I think with HHS, we're trying to build on the national pain strategy that they released in 2016. And so, as I'm sure you all know, but I'll repeat anyway, in 2010, the NIH worked with the Institute of Medicine to conduct a study and recommendations to address pain as a public health problem in the United States. And so in turn, that developed the National Pain Strategy, which has increased awareness, decreased stigma, and push for federal legislators to continue building on the work that HHS is doing. And so I think really focusing on that framing that we're trying to build on existing work that's happening at HHS. And then in alignment with the administration's priorities, just this efficiency of interagency data sharing will, be a steward for taxpayer dollars, making sure agencies aren't doing the same research study without communicating with one another. So I think that is a big incentive for the current administration with these agencies, is that we are trying to just promote efficiency and transparency between these agencies, which will in turn, help patients and help address this chronic pain public health crisis.
And I see Kristen in the chat linked that national pain strategy that you just
Oh,
mentioned.
awesome.
So thank you for that. Another question that we had gotten beforehand was a path forward for legislation for more practicing neurologist experts in types of chronic pain. So in general, we do have healthcare work shortages and also shortages with individuals who are trained in certain specialties, right? Is there anything that your office is thinking about relevant to training the amount of specialists in the field, or things that you've heard from stakeholders about this?
Yeah, so I think at a high level, the healthcare workforce is a main priority of Senator Kaine's, and is also sort of a great example of the nexus of the HELP Committee, focusing on educating physicians so we can address healthcare crises and uplift the workforce. So we have a slew of healthcare workforce bills that will address the problem in different ways. So one example is our Expanding Medical Education Act, which would promote physicians from underserved communities to stay in the community they grew up in. So often, these rural communities, people come out of, they're educated as physicians, and then they leave to go serve another community. So I think this bill really tries to keep people in their communities, especially these underserved, vulnerable populations. And I think as a whole, the HELP Committee is really focused on the healthcare workforce. And so although I can't speak on any specific bill of the specific physicians and specific type of specialists, I think the healthcare workforce is an issue that we've holistically been working towards addressing.
Thank you. And just going back to that chronic pain hub, it would be in website format, right?
Yes, that is the
Yeah.
goal.
Can you talk a little bit more about what all the benefits are to having this?
Yeah, absolutely. So I think when you're talking about the data hub, it's the goal is to be sort of a one-stop shop for patients, providers, and researchers. It shouldn't just be this list of links. The goal is to, aggregate and translate the data that these researchers have provided into, digestible information. And so for a doctor, that may look as a guideline on providing, non-opioid treatments to a specific demographic. And for a patient, it's this verified bucket of truth that they can use to advocate for themselves. And so I think the goal of the hub is, even if that data exists and those gaps are identified, it's not always easy for a patient to just read, this really robust study and understand what that means for them and for their own treatment. And so the goal is to sort of translate that information into layman terms so that patients can use it to advocate for themselves, and doctors can use it to clearly explain things to patients. I think so often, especially when it comes to chronic pain, the burden is on the patients to advocate for themselves and to do their own research into what treatments work and what are, different studies and brand new novelty treatments. And so I think the goal of this hub is to enable and uplift patients and doctors to be able to do that themselves.
And these patients are already going through so much with the chronic pain, right? And
Absolutely.
that makes it difficult to seek out all of this information in different places. So to have it in one centralized location would be something that would be of great benefit to that community.
Mhm.
We have a question in the chat specific to Virginia. Is there any discussion about offering additional Virginia-based funding research incentives to address gaps in cuts or delays in grants from the relevant agencies?
Yeah, so currently, Virginia specific, we're currently going through our appropriations process. And so a part of that is CDS, which is congressionally directed spending. And so government agencies or nonprofit institutions can apply to our office to receive, directed funding from Congress to achieve whatever goal they've set out to. And so, in our office, these are big priorities of ours. And so we receive lots of applications, but we do a really diligent job to make sure that this money is diverse in terms of geography as well as the issues they're addressing. And so, as we consider these applications, we're absolutely keeping the chronic pain population in mind and seeking if there's any, funding that we're able to provide that will uplift a community or a single institution to have a larger impact than they're able to now using these federal funds.
Thank you. And do you think there's anything else that we should know about this legislation that hasn't been covered or about Senator Kaine's priorities? Feel free to share with us.
Um, Not sure about any sort of hidden information that you all need to know, but I'll just reiterate again how powerful and important patient stories are. You do not need to be an expert on everything this bill does to go and advocate for this bill. The importance is that it is one piece of a huge issue when we're talking about the chronic pain, public health crisis. And so I think just recognizing that your story is what will help drive this legislation, even if you aren't aware of all the specific intricacies of what the legislation and specific appropriations do within the bill text. So I would just really try to uplift all of you and advocating for this bill, even if it's not, completely clear the technicalities of it all.
And I see one more question coming in. It's regard to the All of Us program. Is that something that Senator Kaine's office has been tracking?
I'm putting it in my notes right now. We at a high level have definitely heard about that in terms of just research at a super high level. So we'll definitely dig into that and focus on how it can complement this bill in specific. So thank you for that flag.
Perfect. So, thank you, Siobhan. As we wrap up, I'm just thinking about how chronic pain can take so many forms, right? Whether it's arthritis or back pain or migraines or fibromyalgia or pain related to cancer or a host of other conditions that we didn't even mention, whichever one that people might have, they're attempting to manage it every day. And along that process, you're told all these different things that you could try, right? Lifestyle changes and therapies and new treatments. But sometimes when you're living with that pain, even the capability to take those next steps is difficult, right? And if that chronic pain affects your ability to work, then that affects your ability to be able to sustain yourself and your future. So, as you discussed today, this really is just a major issue that calls for a lot more attention in how we have that ability to manage and treat chronic pain, how we truly understand the way that it manifests, and how we move forward toward better solutions. So, thank you again, Siobhan, for taking the time to speak to us about steps forward in exactly that direction, and to all of your team in Senator Kaine's office for all the work that you're doing on this issue.
Absolutely. Thank you so much for the opportunity to speak on this bill to such an amazing group of advocates and organizations. To reiterate, I really hope you all follow up if you have any questions on this bill or want to provide your support. And just a big, huge thanks.
Yes, of course. And thank you as well to everyone who joined us today to listen in and engage. And before we close, did just want to notify you all that our next Alliance discussion is on Thursday, April 23rd from 11:30 a.m. to 12:15 p.m. It's featuring Megan Mott and Steven Steigletter, professional staff members for the minority of the Senate and House Labor HHS Committee, respectively. And Megan and Steven will provide an update on the FY27 appropriations process with a particular focus on NIH. So please note that this meeting will not be open to the press, and the discussion by the speakers and questions are off the record and not for attribution. So registration also is limited to individuals from Research America, member organizations, and if you're interested in joining, please email Jacqueline Lagoy for the Zoom registration link. Her email address is in the chat right now. We hope that you'll be able to join us then. And thank you again, everyone, and hope you have a great rest of your day.
Thank you all.